Thanks a lot. Okay, guys, welcome back. We're on IFCO-TV live at New Beginnings here at the Jersey Shore, and we have a couple of co-hosts, Frank Hahn, Liam, the big deal with Schubel.
Right, Kevorkian's the real deal.
Yeah,
Right?
Peter Kevorkian's the real deal. And then our guest of honor today is Tom Gelardi.
Tom,
Tom,
now he's the supreme deal? Is that what it is?
Yeah, I'm going to say the supreme deal.
Okay.
Tom Gelardi is a graduate from Palmer College, right?
Yes.
Back in, is it 1957?
Correct.
Did I get that right?
January
Awesome.
57.
Yep. Nice. And of course, if you don't know this, the founder of Sherman College in 1973, and true visionary. So, I saw you were named Chiropractor of the Century by the IFCO.
Wow.
Right?
Yes.
Yeah. Oh my goodness. I didn't know that. I just found that out last night.
What century?
Yeah.
Yeah, that's true too. I don't take that too seriously.
Right.
Yeah. So I just saw that, and I just wanted to throw that out there. Liam, what do you have?
Well, you know what? First of all, I'd like to ask Dr. Gelardi, when was it exactly that you? Okay, first of all, I'd like to know how did this come as an idea for you? Like, hey, I think I should start a chiropractic college, because that sounds like a lot of pain to me, right? Yeah. Where did that come into your head?
That was when I was a student at Palmer College.
Wow.
Yeah. The motivation as to why I wanted to have this college changed over time. And when we started the school in 1973, I started it for a different purpose than I had intended in 1955 when I was a student. Back then, I came out of university, and the curriculum was pretty tough. And Palmer School I owe a lot to, and it was a fine school. I just loved it, and naturally changed my life greatly. But there was a lot of testimonials and a lot of rah-rah and not a lot of meat and potatoes it was just different than the university. And I said, working third shift, going through school, and I said, one day I'm going to have a college and I'm not going to waste the students' time, and we're going to give them meat and potatoes.
Wow.
You know, but then later on, as time went on, I started to see chiropractic becoming lost and a lot of compromising being done. And then I said, we need a college that gets back to basics as to what really is chiropractic. Still a good curriculum. The curriculums did improve in all the colleges, and it's a lot different today than it was back then. But the compromising that was taking place and getting away from the general mission of chiropractic was drastically changing. So then that became the motivating factor.
Got it. And now, how did Spartanburg, South Carolina, how did that come into the picture?
Okay.
Because so you graduate from Davenport, Iowa. How do you make it to Spartanburg, South Carolina?
And I grew up in New York, and chiropractic was illegal in New York when I first went to the chiropractor. But when I was in my third academic year at Palmer, Dr. Lyle Sherman, the former executive director of the B.J. Palmer Research Clinic, came and gave a lecture to the class. He had left the research clinic about a year earlier to go into private practice. His children were growing up, and he couldn't afford, on the salary he was making and part-time practice, to pay college tuition. So he had left the college. Actually, he said he had really planned to leave, only put in a year or two at Palmer. But then World War II broke out, and BJ asked him to stay on till after the war, and then the GIs were coming back, and before you know it, he stayed many, many years at Palmer. So anyway, he gave this lecture that really impressed me a great deal about the upper cervical area. And one of the things that he was saying was, and he demonstrated it, showed us an x-ray of putting a probe as hard as you can up against the mastoid bone and seeing how much cartilage was around the mastoid and how difficult it was to get on a transverse. And getting behind the transverse or getting behind the mastoid or in front of it was more effective and explained the knee chest work, which I liked. So I asked if I could meet with him sometime and discuss this further, which he agreed to. And then we went there several times to his office to discuss this upper cervical work. And he said he was retiring or semi-retiring and going to Spartanburg, South Carolina. And again, I wasn't particularly interested in how to build a practice. I felt that if I delivered the goods and chiropractic was so exciting for me, people would want to come to me. I wanted to know how to correct a subluxation. Mm-hmm. So when we went, I tried to set up my practice close to his, and I did within 20 miles of where Dr. Sherman was located. And that's how we became good friends. And my problem cases, and again, I didn't care whether symptoms, if symptoms changed a great deal and the patients were really, really happy and they thought I walked on water, if they were still showing evidence of subluxation, I wasn't happy. Got it. And I took them down to Dr. Sherman. And he would always let me do the work, but he would walk me through it, and we would get that subluxation corrected. If the patient wasn't doing well symptom-wise, but the subluxation was corrected, then I didn't take them anyplace because I didn't think that, anyone, if they're free of subluxation, that was it, that there were other explanations. But it was a great help to me. He was a great humanitarian, and he was just a giving person back to the profession. So when we started the college, we wanted to name it after him.
And was he able to see the college being founded, or?
Oh yes,
yeah? Mm-hmm.
Yes. He lived about 4 or 5 years after the college was founded, and he was always up there several times a week and helping students and so on. They loved him.
And who were some of the principal players then when because you don't start a chiropractic college completely by yourself, right? There has to be a team that you have.
Absolutely.
Who were some of your high-powered players there that kind of brought Sherman College to the forefront?
Well, the number one high-powered player was Reggie Gold.
Okay.
And we started with a board of trustees, but my name wasn't well recognized throughout the profession. So I wanted to broaden the circle and get people associated with a college names that were recognized. And we had an advisory board of 25 people. Wow. And I asked Reggie, I phoned him. I said, Reggie, I'd like to come up to New York to talk to you about being on our advisory board. And he said, Tom, look, I know you. If you're on it, save your money, put me on the board. Well, I had in the back of my mind, I was coming up to New York to really convince him to come and be on our faculty. So he tried to talk me out of coming, but I said, no, I need to come to New York and tell you about it. So we went up to New York, and I said, Reggie, we want you to be on that faculty.
Wow.
And he said, I'm just getting ready to start a postgraduate school in New York to teach people. But he said, it'd be much better to train people properly from the beginning than as postgraduate. Right. So he decided to come. And again, he had one of the largest practices in the United States. And back then, which was 1/10 of what dollars are today, he was making a very good living. And I said, Reggie, we can pay you $15,000 a year.
Right.
and I said, that'll keep the rain off on a rainy day. He said, great. And so he came down.
Right.
And that was one of them. Then I associated with a lot of people on our board, and our boards like Stephen Duff, and people that had name recognition, that when you heard their name, you knew philosophically where they stood, and you knew technique-wise and everything else. That I had heard, or it's been in one of the books, that I founded Sherman College to preserve the upper cervical technique. Well, I'm into preserving the philosophy, the science, or the art. Those things, I don't know what they're going to be like in the future. I hope they're going to be a lot better than they are today. The thing I want to preserve is the mission.
Right.
And in the yin-yang philosophy, the yang, the immovable part of the profession, is the mission, the central area of interest. And the central area of interest of chiropractic is the vertebral subluxation. It's not the wherewithal. It's our contribution to the wherewithal. And the vertebral subluxation, that's the immovable. The movable part of the profession is the philosophy, science, and art. And I expect those things to change and move. But if ever you change the mission, you don't have the profession anymore. And
Right.
and that's what I'm most concerned with.
Yeah, I always, well, I heard you speak a couple of times, and you're talking about the mission is even above the philosophy, and because it's primary, and you get everything else below that: philosophy, science, and art.
Yeah, philosophy is the principles upon which the mission, it explains the mission. The philosophy explains the mission, but the mission is not part of the philosophy, it's not part of the science, not part of the art.
Right.
And it's either right or wrong, and if it's wrong, you walk away from it. If it's right, then you support it, and so on. But the main thing is, too, and I stress this with my patients, that we make a very valuable contribution toward health. But health is much broader than what we do.
Right.
Lifestyle has a lot to do with it. Dentists, optometrists, allopathic physicians, osteopathic physicians, they all make contributions. And our contribution is correcting and seeing that they're free of subluxation.
Right. Right.
And I tell patients, too, that you don't need adjustments. What you need is a spine free of subluxation. And if you come in here and you don't have a subluxation, I'm going to just say you don't have a subluxation.
Tom, as far as so you get the school off and running, you've got Reggie Gold now out promoting, I would imagine, which what he was good at. What is your first challenge that you come across? When's your first line of fire? When is that? Was there one significant moment that you remember, like, oh goodness, we're in for it now? Like this is going to be a huge challenge.
Yes, the school opened in 1973. In 1974, the summer of '74, the Council on Chiropractic Education became federally recognized, and that changed everything. But the states did not begin putting CCE requirements into the law at that time. So we had many students. We had quickly rose to 400 students. We had more students in our first 18 months to 2 years than Life College had. So it really blossomed. But then when CCE came in, and we applied to CCE, and they turned us down, and there's some minutia of what they turned down, but we were willing to fix the library and do a couple added things. But the one thing that we said no, they said a lack of commitment to training primary health care providers within the intent of the CCE. And I said, well, that's true, and we're not really committed, and we're not going to become committed. So then we spent 15 years outside of the CCE, and we struggled. We had good times and bad times, but that was a major, major challenge to us.
Yeah, and one of the things Dr. Matt McCoy talked about this weekend at New Beginnings was that really the central issue right now is this primary care provider. Would you say that's that is the, once we go into that realm, we're in the diagnosis and treatment of disease and pathology and things of that nature, which is off the mission. Is that would you? How
yes,
would you?
I think the primary health care provider, but something even more concrete than that people could relate to is therapeutics.
Got it.
Now, therapy is doing something to relieve a named ailment.
Got it.
And if you're adjusting to relieve headaches, then that is therapeutics, and that's not what I had in mind. What I have in mind is that if you correct the subluxation, the body is always striving, it's not always able, but it's always striving to come back to center.
Right.
And no matter what the situation is, you're always better off without a subluxation. And believe me, I've had as many miracle cases in my office by correcting the subluxation. And patients, you explain it properly to them, and then all of a sudden they don't have asthma, and they're sending in asthma patients. And certainly, when the body's striving to maintain its own health, and the body has an innate striving to do that. I always think about Gray's Anatomy says, that the nervous system controls, coordinates, it initiates, controls, and coordinates all function. Well, it doesn't really do that because dead people have nervous systems.
That's right.
Yeah.
But there's something, again, life itself, innate intelligence, whatever you want to call it, using the nervous system does that. So I said,
is that the term where therapeutic creep comes into play? Like therapeutic creep?
no, therapeutic treatment is really when you adjust someone and said, does your back feel better now?
Right.
Do you feel better now? Or, oh, yeah, we can help. I mean, in yin yang, again, that it's opposites that seem like they're really the same.
Mm-hmm.
D.D. Palmer said, we get at the cause of all disease. And what we're saying is we don't deal with any disease.
Right.
We're really saying what he was trying to say. He was saying all disease or no disease or whatever, keep your spine free of subluxation.
Right, right.
And, you know, if someone is having symptoms and you check their spine, they don't have to have a subluxation. They could have symptoms, maybe from working too hard, or maybe they just are going through some type of thing their body has to deal with. So you've got to be disciplined enough. And again, patients like that. It makes sense to them. I don't see in our examination, whether it takes 1 day or 2 days or whatever it takes to make a thorough examination, you have to say, here is where your chiropractic problem is, and this is my plan of care to deal with it. But you wouldn't go to a dentist who says, today you have a cavity in this molar, and the next day you have a cavity in this canine tooth, and the cavity keeps moving around. It just doesn't work that way. Of course, but if we put a force into the spine, innate will do wonderful things with it, no matter, even if we're doing the wrong things. Not always. We could cause subluxations also. The chiropractic, BJ said chiropractic is specific, and I take that to be any place in the spine. It's specific or it's nothing. And you just can't, it's not a physical massage. We're not doing a massage. Or come in and get your batteries recharged. We're not even dealing with energy. This is the information age, and we're dealing with information coming down the, and it's this mental impulses, which are very different than nerve impulses. It's a metaphysical concept, but we're dealing with mental impulses, packets of information, and if you modify the mental impulse, you modify the expression of that mental impulse in the cells, and you get an incoordination. So,
Right.
And Tom, during the course of Sherman College, what would you say some of your highlights were? Like, what are some of the moments that were very special to you during those years at Sherman College?
well, just one of them. All my time at Sherman College, CCE never got more medical. When we started Sherman College, they had that a school must teach surgery. No, it said a school should teach anatomy, physiology, surgery. And they took that out. And they said, and they announced it, we're taking that out because Sherman College is misrepresenting what that means.
Huh.
Well, we weren't misrepresenting what it meant. We were just telling what it meant.
Right.
So they took that out. The thing I'm most pleased with, particularly as time goes on, that I do think we've clarified that the division in the profession is not modalities. It's not modalities. The division is therapeutics. BJ said, with hands only. Well, I said, if you could get an adjustment through an accident, then certainly you get an adjustment with an instrument.
Right.
I've never used one. I've never had an instrument adjustment, but I recognize why not? It's in the realm of possibility. And the modality, that's not the thing. The thing is the therapeutics that we were getting into. And they were saying, well, if you use modalities, then you are a mixer. And and I think Sherman really defined it differently, and we said that it's vertebral subluxation only for the purpose of greater expression of life, and certainly healing and maintaining the body's health. Those are expressions of life.
Right.
But we just didn't want to creep out and decide, well, are we backaches, or are we headaches, or can we really take care of diabetes, or will we take care of a cancer patient? We don't take care of people for those things, but we take care of everybody. That doesn't mean everyone needs an adjustment, but everyone needs to have their spine checked to see if they're subluxated.
Right.
And
right.
if they're subluxated, they need an adjustment.
Absolutely. Yeah. And it's just staying congruent with that philosophy is very, very vitally important.
Sure. And people may need other things. There's all kinds of factors where they may need medication or such. I'll tell you, I spent 2.5 years in the hospital with a heart problem. And when my brother-in-law tried to get me to go to one of these illegal chiropractors in New York, because I wasn't licensed at that time, I said, chiropractic can't help me. I've got a valve problem. And he said, you've got to see this chiropractor. And I told the chiropractor, I said, look, I don't see how you're going to grow a new valve for me. He said, no, but if you have a weak heart, do you think if your body functioned more efficiently, that a weak heart would last some longer? So I said, yes, okay, fine. But that was when I was 17 years old. I've never seen a physician since that day. I've never had as much as an aspirin. And but if tomorrow I need medicine, I'll go take it. I don't have any problem with it.
Right. Yeah, absolutely. How are you feeling about the profession right now, today, in the way it's moving and progressing?
I am more optimistic now than I've been in a long, long time. I just think that what we were saying, not only me, I'm talking about a lot of people, Reggie Gold and a whole bunch of people, what we were saying, it almost didn't seem like anybody was listening. And then all of a sudden, you know, it's like when spring comes and you wonder, when did the leaves pop out on the trees? And you see it all over, and people like you guys, and but all over. There's a grassroots of people taking ownership of it. They don't feel comfortable in the other model anymore. So I just think that there's some, you know, enrollments are down at all of the schools and so on. Maybe that's a good thing. Who knows? I don't know whether it's good or bad. But I think that things are better now than I've ever seen them before. And I'm just very optimistic about the future.
I feel definitely the same way, especially being around folks when we're talking about the same things, staying congruent with chiropractic, and then sharing that with our communities. It's just wonderful.
If we could get more people out talking about being portal of entry, not primary care, being focused on the subluxation. You look at the dentist, you know, what is it, 24 teeth, something like that? And you have the same upper ones as the lower ones. You have the same right ones as the left ones. So you really only have 6 teeth that you have to know about. Right. If you know 6 teeth, you know them all. They have something like 6 different specialties, from periodontist, orthodontist, a pediodontist, you know, and we will one day in chiropractic have someone as a general practitioner.
Agreed. And
then we will have those who go deeper into the upper cervical, those into the pelvic, lumbopelvic spine, those in the for little children, babies, and so on. We'll have that. But when you think that we have a spinal cord, 31 pairs of spinal nerves, and all these vertebrae, and every one of them is different, we've got a lot of challenges in chiropractic. I don't think.
Yeah, if we could actually focus on chiropractic, there's a lot to learn there.
Absolutely.
Now, Tom, Dr. Gelardi, what advice would you give, to students right now that are watching here from all around the world? You know, from different colleges. Some of them are at Sherman College, some of them are at other colleges. What kinds of advice would you give to them as far as learning their profession, or maybe things to focus on?
Well, 2 things. Mm-hmm. One is a philosophy, because a philosophy clarifies your thinking. And when you think more clearly, then you know what the next step is, what you need to do. The second thing is that all the energy and all the jumping around and the cheerleading is unnecessary. the thing is that if you correct the subluxation, people will pick up on chiropractic, and the subluxation is real. I hear that, sometimes it doesn't make any difference. All techniques work. Well, then just take a baseball bat and hit them, if you believe it.
Right.
But whatever you do, you've got to have indicators of subluxation. And those indicators have to be consistent and persistent day after day to say that vertebra is really subluxated. It can't be subluxated in the morning and not in the afternoon and so on. That's not the kind of subluxation we deal with. Learn the technique, get good mentors, and just be the kind of professional that you would expect from any architect or dentist or anybody else. Just treat people decently. And again, too, just don't be afraid to tell people about chiropractic.
Dr. Lloyd, we have a comment from Sweden.
Oh, great.
Let's take a look here. So, they're talking about the Sherman Academy of Chiropractic Philosophers program, and they're calling from Sweden. So, do we know anything about the Academy of Chiropractic Philosophers?
I know a little bit about it. I've been retired from Sherman now 10 years. But I would suggest getting in touch with Dr. Bill Decken.
Yes.
Do you know?
That's right.
Do you know more about this?
Yeah,
Okay.
Dr. Bill Decken is doing it, and I know, and this is I agree with what you said before, Dr. Gelardi, is that now is a very exciting time for chiropractic because kind of like we've seen an Arab Spring in sense around the world. They've just brought this ACP program by demand to Australia, New Zealand. It's just getting started in Spain next year. It's been in Sweden. So it is almost like we've been pushing. Frank and I were having this conversation for the past 5 years. And now these folks are picking it up on their own and saying, hey, look, we want it. And the pushing is kind of, we've had to step back a little and say, okay, you guys are in charge of that part. You take care of it. One of the things that we had to overcome was this idea that this is an American thing, and really chiropractic is an international, global thing. And everybody has the right to bring that chiropractic, chiropractic, it's the same thing everywhere, to bring that to their part of the world and take ownership of it. That's very exciting.
It's one thing at one time that this brand of chiropractic was Sherman's thing. And I'm glad it's not Sherman's thing anymore.
Yeah, right, exactly.
It's the thing. I mean, it's at Sherman College, definitely. But
well, I'll tell you saw the impact, too, that Sherman College made today. We had the president of New Zealand Chiropractic College, Dr. Phil McMaster, flew all the way from New Zealand to honor Dr. Gelardi. And I have to tell you, I met Dr. McMaster about 3 years ago at a New Beginnings, and he told me he was a student at the school, and many would say, and I'm in agreement, that New Zealand Chiropractic College would not exist if it wasn't for the firm philosophical basis that Dr. McMaster has, that he learned at Sherman College, and the dogged persistency that he has, which he may have learned from you. I'm not so sure.
I think all the founders of the New Zealand College were Sherman graduates.
That's right.
And the first president was a Sherman graduate.
Right, and I think
Jim Stenier.
Jim Stenier. And I think one of the things he told me was that, it just became unfeasible to be sending people to Sherman College. And so they said, let's create, a college here, and actually let's even learn from some of the mistakes we've seen, and let's improve upon it. And of course, they're not even in the CCE bowl game, so they have a lot more freedom of education.
They have the Australasian CCE,
okay,
but it's not like
not as dictatorial as
right.
maybe CCE would be here.
Dr. Lloyd, before we end, I definitely want to say thank you for starting Sherman College. I know you probably hear this often, but you can probably never hear it too much because you've given someone like me a life. And I love what I do every day. I have a family practice. We see mom, dads, and the children in the office. Just yesterday, I set a record for my office seeing people, and we saw a lot from about 2 o'clock p.m. until 8 p.m. I didn't leave the checking table all day long. People were in the office. Families were coming in. People were having to wait outside my office because there were no seats left. And
that's
it
that's
was wonderful.
reward. Yeah, that's
Yeah,
great.
and that's the biggest reward that I think anybody can feel, that your office is flooded because you're sharing chiropractic with everyone. And so I just want to make sure
Thank you.
Thank you.
You know that today I'm being honored here, and I really think that it's on behalf of several thousand chiropractors, particularly the students. The early students, when there were no student loans, we didn't know whether we were closing, their credits wouldn't transfer anyplace, and they took a chance on Sherman College, and it took a lot of, they were the big heroes of the whole thing.
Yeah,
I thank you very much. Enjoy it.
Oh, yeah, pleasure.
Thank you.
Thank you.
Yeah, one second. Guys, we're with Tom Gelardi, founder of Sherman College. We're ending our interview now. Do you have any last words to say, Liam?
Just again, I would echo what Dr. Frank said, Dr. Gelardi. Really, I'm a graduate from another chiropractic college, and I found a home at Sherman College because there really is no other college in the Americas that has that focus on the mission of chiropractic college, and I think it's so crucial that we expand this mission to the world. And as BJ used to say, right, you never know how far-reaching something you think, say, or do today will affect the lives of millions. Well, it's not about millions, it's about billions right now, and it'll be trillions someday. And thank you for having the perspicacity and the persistency to move through with that vision and that mission. We appreciate you.
Thank you all.
Thank you.
It's been a
Thank you.
pleasure.
Excellent. Yep.
Thank you.
And we are good.
Great.
Enjoy it.